All right. Well, thanks everyone for taking a few minutes to attend the presentation. As Alyssa mentioned, she had asked me to speak about the basics of benefits. So we're not focusing on university specific plan designs and things, but just kind of general terms, components to healthcare insurance, really focused on those who are maybe new to health insurance. Maybe you've been on your parents' plan until recently, or will be getting off of their plan recently. Maybe it's something you haven't had to work with a whole lot. And so it's just you're not as familiar with terms. So this is like a 5,000-foot level view of health insurance. You guys are welcome to stop me and ask questions if you want. I would just say keep them very general because obviously everybody's on here and would hear personal health information, so we don't want to release any of that. But if you have general questions about insurance, you're welcome to put in the chat, and Glee on my team is monitoring the chat and can answer those questions there, or you can stop me and ask them. I think we'll have plenty of time because I'm keeping this kind of brief. Nobody wants to talk about benefits endlessly. So as Alyssa mentioned, my name's Angeline Clayson. Angie is fine too. I work on the benefits team here at USU. I've been here 7.5 years, and I've been in HR like 25 years, pretty much since I graduated from college. So lots of background. It's been a good experience, and anyone on our benefits team is more than happy to answer questions at any point. So you're welcome to call our office anytime, and we'd be happy to answer any benefit questions you have. So what we're going to talk about today is first, what is healthcare as it relates to insurance, common terminology, plan types, plan design, networks, summary plan description, savings and reimbursement accounts, the employee life cycle, and resources. Seems like a lot, but it really isn't too bad. So as I mentioned, healthcare as it relates to health insurance is referring to the services, systems, and activities aimed at maintaining, improving, and restoring an individual's physical, mental, and emotional well-being using usually covered, under medical, dental, or vision insurance coverage. Sometimes those coverages will be grouped when you work for an employer, and they'll all be under one. So once you enroll for one, you're enrolling in all. Sometimes they're separate products, so you choose what you want to enroll. But those are the different types of health insurance that gets to those services and systems. So some of the activities that are encompassed underneath this healthcare insurance are first prevention. So those are measures you take to prevent disease and illness, such as vaccinations and screenings. You'll have maybe yearly checkups with a doctor. This is when there's nothing wrong with you. You're just checking in once a year, or maybe a dependent child checking in once a year, mammogram, screenings, colonoscopy, depending on your age. Those are all preventive medicine. That is kind of that first activity or stage of healthcare. Then you have diagnosis, where you're identifying and diagnosing health conditions. Treatment, where you're working with a provider to find interventions, medicines, surgery, things to help with that condition. Rehabilitation, so if you've had surgery, you would go to rehabilitation for that, helping restore employees or individuals to their full health. And then palliative care is more for those who are kind of at the end of their life. They have a terminal illness and you're just trying to make them comfortable. So starting with some common terms in health insurance, the first one is deductible. Deductible is the amount of money that a member has to pay first before they see the insurance company paying any portion of the claims. It's very common. I have never seen a plan design without a deductible, but there could be. But more than likely, you're going to see plan designs that have a deductible. So that's what you, again, pay first before you see the insurance company paying any portion of a medical claim. There is a caveat to that, and that's preventive services. So typically your preventive services are covered at 100%. even if you haven't reached your deductible. And so, as we mentioned with that preventive services, that would be your vaccinations, your yearly checkups with your doctor, mammograms, colonoscopy, those type of things. You'll want to talk to your provider about what is preventive when you make those appointments. So you make sure that they are considered and will be billed as preventive. Otherwise, if not, then you may be subject to deductible, coinsurance, et cetera. A copay is a fixed amount you need to pay for certain medical services, such as office visits and prescriptions. Those are the most common. Sometimes you'll see copays for ER visits too. And again, those are just a fixed amount, and they vary a great deal. We have copays that range on our plans somewhere from, like, for the office visits, $25 to $35 when you go to an office visit. Next is coinsurance. So coinsurance is now when you've hit your deductible and now you're starting to share the cost of claims with the insurance company. We call ours like a 70-30 or an 80-20, meaning that the insurance company will start paying 70% of the claim and you pay 30% of the claim, or they'll pay 80% of the claim, you pay 20% of the claim. Again, this is going to vary between employers and how they design their plan on what that cost share is. But that's what coinsurance means, is you're now sharing the cost of claims with the insurance company. So you start with the deductible. Once you hit the deductible, then you start paying coinsurance. The coinsurance, the deductible, typically, but again, it depends on plan design, not always, will go towards your out-of-pocket max, that next term there. The out-of-pocket max is the most you would pay during a plan year. I kind of call it your stop loss. You know that if something major were to happen to you, that's the most you would have to pay in that plan year, after which, once you hit that 100%, then the insurance company, once you hit your out-of-pocket max, then the insurance company starts paying 100% of your claims. Now, that's only going to be for the plan year, so keep that in mind. Whatever the plan year is, it's going to vary between employers. What the plan year is for the universities, ours starts on July 1st and goes through June 30th. So every July 1st, we start over hitting our deductibles again, paying coinsurance, and then potentially hitting our out-of-pocket max. I will say, even though it's important to know what your out-of-pocket max is on the plan that you choose, the vast majority of people are never going to hit their out-of-pocket max. And actually, a large portion of people don't even hit their deductible in the plan year. And that's kind of important to understand, because that will help you in deciding what plan is best for you if your employer offers multiple plan options. So there's two basic different plan types. There's a traditional plan and a high deductible plan. And these are structured somewhat by the IRS and the Affordable Care Act. But here are the three main differences between your traditional and your high deductible plan. Regards to the deductible, a traditional plan is going to have a lower deductible than your high deductible plan. Makes sense. That's why we call it high deductible, right? The premium for a traditional plan is going to be higher than what you will see on the high deductible plan. And the out-of-pocket costs on the traditional plan are going to be lower than what you experience on a high deductible plan. So it's kind of a risk analysis a little bit there. For those who, I guess, don't like as much risk, they may want to have a traditional plan. And again, this is all assuming you have multiple options at your employer. But a traditional plan, again, is going to have a lower deductible and a lower out-of-pocket max, but your premiums are going to be higher than what you will see on a high deductible plan, and you're going to pay lower premiums. So you're taking on more risk with a high deductible because you'll have to pay more money up front if something happens. But there are plenty of good sides. I don't want to dissuade anybody from a high deductible plan, because I actually love high deductible plans. The basic idea around a high deductible, right, is that even though you're taking on more risk, you're kind of hopefully retaining that money for yourself rather than paying higher premiums to an insurance carrier month after month, whether you hit a deductible or not. And again, many people don't even hit their deductible. You're on a high deductible plan, you're going to pay lower premiums, keep the premium for yourself, and hopefully you'll be saving some of that money. So if and when you have experience a need for medical services, you'll have some money saved to pay for those expenses, but at least that money's staying with you. And we'll talk in a little bit about savings options for you. So again, that's kind of a very basic difference between traditional plans and high deductible plans. So next, I want to mention a summary plan description, just because it's important for anyone to remember that this is a resource for you. A summary plan description, or SPD as we call it, is a document that employers must provide to employees participating in their health benefits plans, outlining the key details of the plan, including their rights, responsibilities, and benefits in clear, understandable language, which is required by the Employee Retirement Income Security Act. So every employer who's offering you health insurance is going to have a summary plan description that should be readily available for you. And it's going to tell you all the rules around the insurance, what's covered, what's not covered, at what percentage amount, what are the deadlines you have to meet for enrollment. So this is a really good resource if you have any questions about what is going to be covered for you. So now let's talk about savings accounts that can help you paying for those medical expenses. And the first one I wanted to talk about is a flexible spending account. And there are actually two types of flexible spending accounts. There's a healthcare FSA and a dependent care FSA. The dependent care FSA is strictly to pay for child care expenses. So if you have a child who is in daycare and you want to have a tax benefit, then you would want to sign up for a dependent care to pay for those child care expenses. It can also apply to elder care potentially, but we're not going to focus on that one because we're really talking about healthcare expenses right now. So the other one is a healthcare FSA. Now, you can have a healthcare FSA regardless of the plan type. If you're in a traditional or a high deductible, both would allow you to have a FSA. You would only be eligible through an FSA through an employer. So it's not something you can go and do on your own. Your employer would have to offer an FSA, but FSAs have been around for a very long time. And I would think most employers who offer health insurance options are going to also offer an FSA option. What an FSA does is it allows you to elect a certain amount for that plan year to have deducted from your paycheck in equal installments typically throughout the year that is pre-tax dollars. So it's money that you don't have to pay taxes on, and it gets put into this flexible spending account to pay for health-related expenses. Let's see. Now, there are certain things that you have to use the funds for, but it's a pretty expansive list of what you can use those funds for. So prescriptions, eyeglasses, dental appointments, medical expenses. It's quite a long list. If you ever question what is covered, you can go to IRS Publication 502, and that spells out exactly what would be covered, would be eligible for FSA fund reimbursement. One of the upsides to an FSA is it's what we call front-loaded. So you make your election of how much money you want to contribute to the FSA for the total of the plan year, and all of those funds get front-loaded into your FSA account. So again, using the university as an example, our plan year starts on July 1st. We make elections in May. So if I elect, let's say $3,000 during our open enrollment, which we'll talk about on July 1st, that $3,000 would be available to me. So that is kind of a benefit if I maybe have a planned surgery in July or something earlier on in the plan year. I don't have the time to save up the money for those expenses. my FSA is front loaded. So that is a benefit to having the FSA is you have that front loaded and then you're kind of just paying yourself back throughout the year, paying that loan back throughout the year by those deductions. The downside to FSA is it's what we call a use it or lose it system. So whatever you elect, you need to use by the end of the plan year or you lose those funds. So that $3,000, if I didn't find a way to use those dollars, I would lose that. So you really want to make sure you have a pretty good idea of what your expenses will be, whether you just do your known expenses like prescriptions. If you do have a surgery, maybe you know how much approximately you're going to spend there, those known expenses. You could also go back and look at past years to see approximately how much you and your family have spent in years past and maybe average it out if you want to, but you really want to make sure you're pretty careful on that so you don't lose any of those funds. Some employers will have what's called a grace period that'll allow you additional time to use those funds. So even though they have to be used in the plan year, which is 12 months, there may be an extended period of time that you can incur expenses and submit for reimbursement. Sometimes some plans will allow a set amount of the FSA funds, not all of it, but a set amount to be rolled over into the next year. So that is a possibility as well to kind of help alleviate that use it or lose it that scares some people. The next one I want to talk about is a healthcare savings account or an HSA. The HSA, you have to be enrolled in a high deductible plan to be eligible for an HSA. These are rules under the IRS. And so if you're in a traditional plan, you are not able to enroll in an HSA. It's an employee-owned bank account that allows you, again, like an FSA, to make pre-tax contributions into that account. So you can actually go and start an HSA on your own at any bank that offers to set up an HSA. Now, the IRS is going to want verification that you're eligible to have an HSA. So you would have to provide proof that you're in a high deductible plan in order to do that. But it is technically possible. Most people who do this, they do it through an employer because when an employer offers a high deductible health plan, they're also going to offer the HSA to work with it together. So again, you're saving pre-tax dollars, you're making an election, and those pre-tax dollars are going into that bank account. You can take that HSA dollars with you when you leave a job. So again, it's your own bank account. So it's not something, and it's your dollars going into that account. So you take that money with you. You can use and you use these funds just like you do for the FSA, medical bills, co-pays, prescriptions, glasses, dental, all those expenses. You use the same IRS publication 502 to see what is eligible to use those funds for. The really upside to an HSA is that it's not a use it or lose it system. So any funds that you don't use during the plan year will roll over into the next year. And then you make more contributions into your HSA, and anything, again, you don't use rolls over again into the next year. And you don't have to pay taxes on this money so long as you use it for health-related expenses. In addition, any money you contribute, I shouldn't say any money, some money that you contribute into an HSA can usually be invested. And then you make gains off of that money. And as it says on that last slide there, it's considered a triple tax benefit because you're not paying taxes on the contributions. The investment gains that you make on that are tax-free. You don't ever have to pay taxes on that money as well. And when you withdraw the funds to use them for health-related expenses, you don't pay taxes on it. So you're never having to pay taxes on this money that you're accumulating in your HSA. And so you can kind of think of it as a retirement plan for healthcare. So your 401ks, your 401as, you can use for everything else that you'll need in retirement, but you can use your HSA dollars for Medicare premiums and just all the expenses you can expect to have as we age and utilize more and more healthcare. So it really is a great way to save pre-tax dollars that you never have to pay taxes on for health-related expenses. But again, you have to be in a high deductible health plan to be eligible for this. So that adds to that balance of what works best for you. A traditional plan with an FSA with lower risk maybe, or a high deductible where you can save money into an HSA and prepare for retirement. Another one I wanted to mention about is really more of a reimbursement account, a health reimbursement account versus a savings account. This is less common than an FSA or an HSA, but you may work for an employer who offers this. A health reimbursement account is an employer funded account that helps employees reimburse for healthcare expenses. The employer can choose what those expenses apply, the HRA dollars apply to, but they are still not taxed. And so it's a set amount of dollar. The employer may say, okay, we're going to give you $1,000 in an HRA every year to use for healthcare expenses, and they'll tell you what expenses can be used for, and whatever's not used at the end of the year, either you may lose because it's just a new amount every year of that same amount. Sometimes employers will roll over a little bit of that amount, so they'll allow a portion of it to roll over. It just depends on the plan design. And then if you leave your job, you generally cannot take your HRA funds back with you. And I'm just realizing as I talk about this, I think I missed a slide, so I apologize. Let me go back. I hope it's not going to be too confusing for you guys. So let's rewind a little bit here. We talked about the traditional and high deductible plans too, right? So those are the different plan types. There is also what we refer to as plan design. And I wanted to make sure to just explain this in brief, that a plan design can be made by an employer. They choose exactly how they're going to design that plan, what the deductible is, the co-insurance, et cetera. They're going to work with the health insurance, to make those plan designs. Sometimes they just purchase it from a health insurance provider. Sometimes they're planning the design on their own, but it really is a delicate balance to make that plan design and make sure it's considering factors like cost, access, and preventive care, because they have to make sure that from year to year, this plan is going to be solvent, right? That it's going to be able to meet the needs of everybody, every employee, while trying to still maintain premiums that employees can afford. So that is, and I say that because you're going to see so many different plan designs. If you go for many employers, they'll all look a little different. And that's why you want to take the time to understand with each employer that you go to what their plan design looks like. Another important component in making choices in your healthcare is networks. So networks are, health insurance network is a group of healthcare providers that have agreed to provide services to health insurance plan members. These providers are called in-network providers. So basically, insurance companies are reaching out to doctors, healthcare providers, mental health providers, and saying, will you accept these costs on these various services? And if the doctor provider agrees to it, then they're considered in-network. And that creates the network that you're choosing. You may be able to choose networks at your employer. At the university, we have 2 separate networks that employees can choose from. Sometimes there's just one network with your employer and you're not able to choose that. But it is important to understand what network is. And it's also important to understand that out-of-network providers are going to cost you more, and potentially significantly more. We have employees, unfortunately, sometimes who don't always think about the network side, and they just maybe make an appointment for a surgery at a hospital, don't make sure it's in network, and then it's not going to be covered because they went out of network, or it will only be covered at the rate as if it was in network. So that difference between the in-network price and what the doctor is charging would be all the responsibility of the member. So you definitely always want to make sure that you're going in network. Another time that comes up as an issue I know is when you go into a doctor's office, you know the doctor's in network, but the doctor does lab work, maybe takes some blood and sends it to the lab, and the lab isn't in network. And so then you end up having a bill that's larger than you expected, having to pay for the lab work. Doctors tend to be pretty good to let you know that you should check to see if the lab is in network or let you know if it's in network or not, but you can't guarantee that. So that's something you want to check with as well. So the last one I wanted to talk about really is the employee life cycle, because this is important to you as an employee, knowing when you really need to be thinking about benefits, right? It's not something that benefits aren't something that people typically want to spend a lot of time thinking about. And that's because life is crazy. But these are the times you probably should think in your mind, I need to spend a few minutes thinking about my insurance. Obviously, as a new employee, you're going to be offered insurance and benefit options, and you want to take the time to understand what they mean for you, costs, impact, how long you have to enroll. That's one that's really important that people will miss. On the university insurance, new employees have 30 days to enroll. So you want to make sure you understand what those requirements are. When is the insurance going to start as a new employee? Ours starts day one of employment, but your employer may have a 60-day waiting period. So you want to understand that too, because you may need to find insurance to fill in that gap. Who knows? So taking the time as a new employee to understand your insurance is important. The next item is during open enrollment. Open enrollment is a once a year window where employees can make changes to their insurance. So we have some insurances that you can make changes to during the year, but some that you cannot. So like our medical, dental, vision, and this is pretty standard. You elect them as a new employee, and then you're stuck in whatever you elected until open enrollment, where you can then make changes to your plan if you want to for the next plan year. The window of open enrollment varies. I've seen them where they're 2 weeks long, a month long, but you really want to make sure you know when the open enrollment period is, so you know you can look into what changes you may need to make. Your employer may have made changes to the deductible or the plan design somehow. So what does that mean to you? Does that mean you need a different plan now? Possibly. Maybe the network's changed. So those are important things to understand. FSA, you can only elect once a year during open enrollment, and you do it every year during open enrollment, so it doesn't carry over from year to year. HSA, you can change anytime during the year. So that is another upside to HSA, but those are the things you want to look at during open enrollment if you need to make changes. Life event is the one time outside of new employee and open enrollment that you can make changes to your insurance as well. This is like a marriage, divorce, birth of a child, death of a family member. These are all life events that allow you to make changes to your insurance. But again, there's going to be rules about when you can and can't make changes to your insurance and how much time you have to make changes. Just like as a new employee, the university employees have 30 days, right? Life events, they have 30 days too. So if they give birth to a child, adopt a child, they have 30 days to notify us to add that child on insurance. If they don't, then unfortunately, the child is not able to enroll in our insurance until open enrollment. And this is very industry standard. So you want to make sure you understand that again, wherever you go, so you don't miss those windows for life event changes. And usually they'll require documentation with those life event changes. The last period of time is at termination. You really want to understand at termination, how long do your benefits go for? Is your health insurance going to end on your last day of work? Will it be the last day of the month in which you worked? There are changes. Again, it's all about plan design. So it's important to understand how much time you have on your health insurance. Some benefits will run a little bit longer, potentially. So it's important to reach out to your HR office and find out what that means to you. Who's the COBRA vendor? If COBRA, which is a continuation of benefits that you had at an employer, if that's something you need to take advantage of, Who do you need to watch for your COBRA paperwork to come from? Again, all important things during this employee life cycle to think about. And the last thing I wanted to mention is just recognize that there are resources for you. We wish we'd have employees call a ton more to ask questions rather than finding out after the fact that something they didn't understand something correctly. So do not be afraid to call your human resource office and ask the questions. Health insurance is confusing. We get confused. So there's no judgment here. So please reach out to your human resource office, to the insurance carrier. Ours is Blue Cross Blue Shield. They have a customer service office open for many hours every day of the week. So you can call your insurance carrier as well. There's also maybe other resources for you to help understand your health insurance. And so you can ask your human resource office about any other potential resources there. For instance, our life and disability vendor previously had a third-party vendor called Health Champion. Health Champion would take multiple insurance. So if our employee had our insurance, their spouse was with a different employer and had different insurance, and they wanted to compare them and see which may be better, Health Champion would do that. You could send them claims, and say, help me make sense of this. Am I getting charged the right amount? So I just want to make you aware that there may be other options. An employee assistance program that most employers offer, they may be able to provide support in helping you understand your insurance. So just make sure you're asking these questions so then you have all the resources available at your hand. So that was a very quick, high-level overview of benefits. Is there any questions anybody had? I know Glee probably has been answering some.